Hello everyone, my name is Melina Sam, and the title of my research is Your Home is Not Always Your Safe Space, where we'll go into depth about the relationship between housing and health. Before we get started, I'd like to thank Professor Faust and Professor Perry for their research opportunity and the guidance through my project. To get us started today, I'd like you to reflect on a moment when you've had a cough or maybe shortness of breath. What did you think caused that to happen? Maybe you thought of the day you took a cold shower, then went outside, or slept with your window open, or maybe you caught something while hanging out with a sick friend. Those are all logical conclusions to draw. However, could you ever imagine your home being the cause of your health problems? If you find this to be a far-fetched idea, then you should consider yourself lucky. For a large population of our society, we see a strong correlation between one's health and their housing. In order to better understand the relationship between housing and health, this research will highlight specific examples of how a person's health has become jeopardized because of their living conditions. Then we'll try to understand the bigger picture of why we see a disproportionate spread of housing inequalities. And finally, we'll take the time to understand some possible solutions. With some changes to our healthcare system, we have the opportunity to get to the root of an individual's health concerns and strive for better housing. Now let's get into some background. For this research, housing is an umbrella term for the environment one lives in that includes air quality and the housing condition itself. According to the Office of Disease Prevention and Health Promotions, they define housing quality as the physical condition of a person's home, as well as the quality of the social and physical environment in which the home is located. Housing quality has a great effect on our lives. Poor housing quality is associated with various negative health outcomes, including chronic disease, injury, and poor mental health. The next term we'll talk about is social detriments. These are the economic and social conditions that influence individuals and group differences in health status. The final term is life chances, and this is the theory of the opportunities each individual has to improve his or her life quality. Now that we have some context on some terms that we'll get into a little later, let's get into the real relationship between housing and health. In an article from the Housing and Health Inequalities, share a synthesis of systematic reviews of interventions aimed at different pathways linking housing and health. They explain the relationship between housing and health in 3 pathways. This includes internal housing conditions, area characteristics, and housing tenure, which are all social detriments of health and can increase an individual's stress levels. Social detriments of health are controlled by structural issues within our society, as well as life chances, which again is the theory of opportunities each individual has to improve his or her quality of life. Not everyone has to deal with poor housing quality, but the same way some people see their home as their safe haven, for many it is the root cause of some of their physical and mental health problems and the cause of majority of the stress in their life. According to Housing and Health Inequalities, they share how the 3 specific ways housing and health relate are seen. Internal housing conditions have potential to influence health. Cold and damp conditions may cause or exacerbate respiratory health conditions. Poisoning may be caused by lead piping, lead paint, or carbon monoxide. In addition, housing design and street layout can impact on psychosocial outcomes, and housing tenure may also have an impact on one's health. For example, owning one's home can create a greater sense of security or prestige than social or private renting, and is often used as an indicator of greater long-term command over resources. The issue with housing quality lies in the disproportionate spread among racial groups and social class. Deprived areas experience higher levels of crime and social disorder, making it more stressful and dangerous to live in them. They also suffer the most with poor housing quality. For instance, impoverished areas lack access to amenities that other neighborhoods may have. As a society, where do we begin to provide a better way of living to those in impoverished areas? How do we fight social structures to provide better lives for people? Now let's take a look at how housing impacts our physical health. To understand the extent of which our homes can impact our physical health, I went and found a few examples from a few different sources to help better illustrate the lasting effects. It is important to keep in mind the unequal distribution of health has led to a growing awareness that health is socially determined by factors originating in different levels of society. In a more general perspective, deprived areas may experience higher levels of crime and social disorder, making it more stressful and dangerous to live in them. Stress is bad for anybody, but especially children. There's something called toxic stress, which is the response that can occur when a child experiences strong, frequent, and prolonged adversity. Toxic toxic stress can lead to lifelong health problems like heart disease or cancer. It can also lead to mental health issues such as depression, anxiety, substance abuse, or even suicide. That may already seem like enough. However, there is a surplus of issues within the household that can affect one's physical health. The article, Housing and Health Inequalities, share many aspects of internal housing conditions have the potential to influence health. In particular, cold, damp conditions may cause respiratory health conditions. Lack of safety equipment can lead to many injuries, particularly among children and elderly. Lack of smoke alarms, such as fire extinguishers and sprinklers, may exacerbate the risk of injury from fire. There is some evidence that housing design and street layout can also impact one's psychosocial outcomes. Many of these household issues can go unrecognized for years. Then one day we notice we have trouble breathing or we have a new disease to worry about, and it started from our home. Housing does not just affect one's physical health, it has the ability to affect one's mental health. Before providing evidence as to how we see a relation between one's mental health and their home, think of your time during COVID lockdown. Was it a breeze to live, work, and play at home with your family or roommates 24/7? Although COVID was an isolated situation, and we have seen housing continuously affect one's mental health through the years, COVID has emphasized existing issues with one's home. In the academic journal, The Conversation, they share stories from lockdown. Interviews show how poor housing quality made life even more tough. In this source, we will specifically be discussing the overall conclusion of the effects housing has on both physical and especially mental health. The article states that many households express a suspicion that landlords were using lockdown as an excuse to indefinitely postpone or delay repair works, and others reported that their landlords refused to arrange repairs. People told us about leaking roofs and guttering, and about how water coming into their household had caused internal damage, damp, and mold. If a household had a minor issue with a leak in the past, the issue has now worsened to the point where it can have detrimental effects on one's health. The article shares accounts from individuals who now have to deal with moldy, damp living conditions. One person shares, "I've got really bad damp in my house. It's always bothered me, but it's bothered me more and more and more because I work from home, and I'm working in the kitchen and I'm looking at it every day, directly seeing it there. It's just getting worse. The landlord keeps saying, there's nothing I can do." If the situation was unbearable before, spending all day, every day at home, it is now unlivable. However, beyond physical issues with the home, there are financial issues that some may argue have greater effect on one's mental health. Think of the security of your home. How likely are you to pay your bills on time? Is your home a rental or do you own it? Evidently, there are a lot of reasons one's mental health may suffer due to their housing. For instance, community health, residential stability, how often family moves, crowding, and homelessness all have physical and mental effects on your health. The outcome can be youth behavioral problems, violence, injuries, and cohesion and civil engagement. We can see that all of these outcomes are stemmed within one's home and their environment. Housing inequality is not seen amongst everyone, and although all races are affected, there is structural racism that leads some people into poor housing more than others. Let's take a look at the bigger issue. Systematic racism is a form of racism that is embedded through laws within society or an organization. It can lead to such issues as discrimination in criminal justice, employment, housing, healthcare, political power, and education. For this research, we will be analyzing systematic racism in healthcare. In the article, the pandemic has exacerbated health instability for renters of color. They describe specific inequalities during COVID. However, they also shed light on the history of racial discrimination in housing. Specifically, in 2019, before the coronavirus pandemic, an estimated 34 million individuals were living in poverty in the United States, with Black and Latinx people experiencing higher rates of poverty than white. Native Americans, Black, and Latinx renters were also more likely to be extremely low income. Either you have experienced or heard of the long history of housing insecurity amongst people of color, as they are racially targeted, and this has led to discriminatory practices and disparities in housing options. You may think that by now there would have been some progress in limiting this discrimination. The Fair Housing Act was passed in 1968, which prohibits discrimination against applicants and tenants based on various identities, including race. Although, despite that, the Federal Housing Act and its amendments overt and subtle racial discrimination still occurs. In 2019, 8,200 fair housing applicants were filed for discrimination based on housing or national origin. Much like many efforts to stop systematic racism, we see the FHA fail. One of the previous concerns about housing and health mentioned is stress. Stress can affect us physically and mentally, specifically people of color. Cost-burdened renters, particularly those of color, are the most at risk of eviction due to the increased likelihood of missing rent payments. The everyday stress of knowing whether or not you can pay your bills negatively impacts one's overall well-being, and it is not because of one is unwilling to work hard to have a better life. It is because of the systematic racism engraved in our society, in housing, criminal justice, education, and healthcare, and it affects people of color much more. They are more likely to experience homelessness across their lifespan. As a result, communities of color are overrepresented in homeless populations, with nearly 40% of people experience homelessness identifying as Black, 22% as Latinx, and 3% as Native American, and 2% as Pacific Islander. How do we try to protect those who have been pushed into poor housing, and how can we improve their mental health? With all this information in mind, there are still some hopeful solutions. And although it would be nice to stop systematic racism and fix everyone's housing situation, we are far from that. We can still take a step towards fair and equal society. One of the small changes we can make is in our healthcare. Rishi Manchada discusses in a TED Talk on a different way of looking at healthcare, the upstreamist approach. It is a simple solution where doctors ask the right questions and know the community in order to get to the root of the problem. In order to better understand the upstreamist approach, it is important to understand the downstreamist approach, which is where interventions are located closest to the parent source of health problems. This is how our healthcare has worked in the past and still continues to work in many areas. When you go to the doctor's office, they are reactive treatments rather than proactive treatments. You are given some medication or inhaler rather than being asked if your house has a leak or mold. Dr. Manchada shares specific instances where he uses the upstreamist approach. For example, his patient Veronica lives in South Central LA and her home had roaches, mold, and water leak. Dr. Manchada pointed out her chronic illnesses, but what was different about his approach was that he pointed out the causes of the illness started at home. He provided treatment plans that went beyond the doctor's office by involving a community healthcare worker and public interest lawyer. Her symptoms started to improve by 90%, and her son was no longer dealing with asthma once Dr. Manchada's efforts improved her housing condition. This is where we see how important it is to identify that our health begins where we work, where we play, and where we live. By altering our approach to healthcare, we can help limit the negative effects on one's home has on their health. Rather than putting someone on medication, we can go to the root of the problem to see if our health problems are started at home or by some other external factors. Majority of the time, these unstable and unsafe living conditions are not following proper legal regulations, and with the right assistance can be improved, just like we saw in Veronica's story. Ultimately, the solution is to use the upstreamist approach in our healthcare and truly ask the right questions in the doctor's office. And as patients, we can help by letting our doctors know of any pre-existing issues in our household. While we remain patient in the pursuit of a fair social structure, we can take an alternative approach and use the upstreamist approach in order to stop our home from being the downfall to our health and to truly make our home our safe haven. Thank you for your time.